Although the anatomy of the pelvic region has been known for many years, the function of the short arc muscles within the lower pelvis, the pelvic rotator cuff, has not been previously well delineated. Sagittal plane motions of the pelvis have been studied extensively, but transverse plane motions of the hips and pelvis, which are controlled by the pelvic rotator cuff, have not been analyzed in depth. Much like the short arc muscles of the shoulder rotator cuff, the short arc pelvic muscles work together synergistically to accomplish several tasks simultaneously. This series of pelvic muscles is essential for standing, walking, dynamic stability of the back, and bladder and bowel health. Understanding the form and function of the pelvic rotator cuff is a major key to diagnosing and treating pelvic musculoskeletal and urogenital dysfunction. The purpose of this presentation is to describe the muscles and function of the pelvic rotator cuff, its role in back and sacroiliac function, in standing balance and walking, and its control of bladder and bowel function. The pelvic rotator cuff is composed of a series of muscles, ligaments, and fascia contained within the lower pelvis and finds its support and many of its major attachments on the bony pelvis. The muscles of the pelvic rotator cuff include the obturator internus, superior and inferior gemelli, pelvic diaphragm, urogenital diaphragm, external sphincters, and adductors. The obturator internus runs from the greater trochanter of the femur around the lesser sciatic notch and attaches on the lateral aspect of the arcuate tendon and the internal perimeter of the obturator foramen. The arcuate tendon attaches anteriorly on the pubic bone and posteriorly to the ischial spine. The pelvic diaphragm muscles attach to the medial aspect of the arcuate tendon and to the pubic bone and sacrum. This allows the interaction between the obturator internus muscles and the pelvic and urogenital diaphragm and external sphincter muscles. The pelvic diaphragm interdigitates with the external anal sphincter. The external anal sphincter interdigitates with the urogenital diaphragm muscles at the perineal body. The adductor longus and brevis muscles attach to the pubic bone and shaft of the femur. The muscles of the pelvic rotator cuff work together as a unit during upright activities.